In this video, our two students, Cami and Bailey, who will both be RDH soon, will go over some of the oral hygiene instruments that we use in the long-term care facilities and their recommendations for use.
So we're going to talk about denture cleaning. So you just put a small amount of dish soap or hand soap and then warm water. So you want to have warm water, and you make sure you have a towel at the base, because if you drop this, you don't want it to break, and so the towel will give it a cushion. So warm water, wet up the denture, and then you just use the brush and brush all around the denture, and then that has a skinny end here so you can get into all the little crevices, and make sure that you brush all around the denture. And even like within here, you want to just do little circular motions like you're brushing teeth to get those bristles into the contact area. You might even need to use the small end of the brush. And then you rinse it off, and then set it down, and then get the other one, and just repeat the process. And it's okay to look and just make sure that we get everything that we need to get. And the same with partial dentures. What a partial denture is the difference between a full and a partial. Is a full is going to be a complete set of teeth. This is going to just have some teeth on it because the patient has natural teeth in their mouth. And so you just do the same thing. Use your brushes. Make sure you push it in here and get as much as the food and debris out. And then you just rinse it off. And then you get your container. You fill it up with water. It doesn't matter if it's hot or preferably warm, but it's okay if it's cold. And then you just set these in. And then this is an Efferdent tab. You want to make sure that it's fully submerged in water. And then you just set the Efferdent tab in there, close it, and then it's good until the morning.
Hey, this is a mouth sponge. I typically use this for patients who are in hospice care. You could also use this for patients who don't have teeth, because toothbrushes can be too abrasive on the gums when cleaning them. So I like to do, first of all, I want the resident to be in semi-supine position because they have issues swallowing when they're in hospice care. So laying back semi-upright, and then because they have their mouths open, a lot of the times their mouths are going to be super dry. So all you want to do with this is just simply moisturize their tissues using the mouth sponge and water. And a lot of the times you want to get their tongues too. You could see that their tongues are wrinkled because it's so dry and they typically close on it. And that's that.
This is an ultra soft toothbrush, so it's super soft. It has a bunch of really fine bristles, and this is meant for patients who have really sensitive gums or a lot of recession. The times that I've seen this is with patients who just have extremely dry mouth and their gums are already sensitive. So what you would do is you would brush with it just like you would a normal toothbrush. You would just tilt it in at a 45-degree angle. And I just massage the gums, and you just do it all around the mouth. It's about the time you spend brushing, not about how hard you do it. So really, this is the one where it's like crucial that you brush for the 2 to 3 minutes and just gently massage the gums. I tell my patients that this is their, daily gum massage. This is a triple bristle toothbrush, and what this is meant for patients who struggle to stay open for long periods of time. Also, it's really efficient in that way because then you're able to brush several surfaces of the tooth at once. It does the buccal, the lingual, and the occlusal. So what you would do is you would place it where you need to go, and you turn it on, and then you would just gently massage back and forth. You spend 2 to 3 seconds on each tooth. And then this right here is called an end tuft brush. It is like a toothbrush. It just has the bristles, but it's in a more concentrated region. And this is to help you get back into areas where you can't fit a toothbrush head. For example, right along back here. And what you would do is you would just gently massage it through into the gums, just very similar to like you would a toothbrush. And sometimes when people have enough recession due to perio, they get these little triangles, these black triangles in between teeth, and you would just push those in there and brush along. Also along the gingival tissue on the tongue side, it's really great. You just push it to the gum line and gently massage back and forth. This is called an interdental hygiene like scrub brush or interdental brush. What this is meant for, this is meant to go in between teeth when floss is no longer effective due to periodontal disease and attachment loss. So if people have a bunch of recession where you see a black triangle, it comes in a variety of different sizes. So if you feel like this goes in too easy and it's not touching each tooth, then you need to go a size bigger. Or if you feel like you're really struggling to push it in, get a size smaller. So what you do is you see where that gingival tissue comes right to a point. You put this right in between and gently massage it back and forth in between the contact. And you'll continue to do that throughout the mouth. And what this does is this opens up and gets all the concavities of the anatomy of the tooth. So this is a tongue scraper. This comes in there's several different brands to this. What this does is this goes along the tongue and it scrapes off any of the film, any of the debris, because you still need to brush your tongues. So it's just a tongue scraper. And then what you do is you just go back like this, rinse it off, back like this, rinse it off, and then you could just get the excess debris with your toothbrush. This is a rubber tip stimulator. If you look closely, it really is just a stiff piece of rubber that points. And this is meant to help with people who have inflamed gingival tissue, so gum tissue. Also, when they have had enough recession or attachment loss, the tooth has grooves, and this is really, really good to get into those grooves. Like for example, what you would do is you would come in at an angle, 45-degree angle, and then you would just massage it and do little circular motions, and then right there you see how it dips. That's called a furcation, and a lot of patients who have recession due to perio or trauma, and they can't get their toothbrush down there, so it's really important to be massaging with a rubber tip stimulator, and then you just do it throughout the whole mouth. You don't have to, it will guide you, so you don't have to jam it in. If it's there, it'll go in there. If it's not, then you just let it guide you. Xylitol chips, they're called ice chips, and so they're just little xylitol candies, and what these are really good for is to roll around and have patients suck on them so that it trains the salivary glands to produce more saliva. So these are really good for patients who have dry mouth. So you take a little piece and you just have them suck on it and just move it around their mouth. Don't have them chew it, don't have them bite it. It's just meant for them to suck on it.
Okay, these are Xyla melts. We use this for patients who have dry mouth or xerostomia. A lot of people like to use them at night and put 2 of these in their mouths. How they stick in the mouth, see this darker side? That's the part that goes against the tissues, and then this side sits outward. And I'm gonna show you how you put it in the mouth. Be open for me. So a lot of patients like to put it up on the gum line over here, right above the teeth. And that darker part, that just sticks onto the gums. And you could let go. And you have a saliva gland right across from there, so it helps stimulate saliva at night.